Hey everyone, ready to dive into some serious medical tech? We're talking mechanical circulatory support, those devices that can literally lend a hand to a struggling heart.
It's a fascinating field, and this research paper you sent over really gets into the nitty-gritty.
So our goal today, we're going to unpack all of this from understanding exactly why someone might need mechanical support to exploring the devices themselves.
Some of this stuff is straight out of science fiction, honestly.
Yeah, the paper starts off strong, talking about something called cardiogenic shock. Sounds intense, right?
Yeah.
Like the ultimate heart crisis.
Absolutely. It's a situation where the heart just can't keep up with the body's demands. The paper mentions if your systolic blood pressure dips below 90 millimeter Hg, that's a big warning sign, and it can spiral from there.
Yeah, the paper doesn't hold back. Organ failure, even death. It's like one thing goes wrong and the whole system can just crash.
And often, at the heart of it all, is left ventricular failure. The paper really zooms in on two main types, HFrEF and HFpEF. Basically, different ways that the heart's main pumping chamber can go haywire. Okay, those acronyms always throw me off. It's like alphabet soup. Break those down for me one more time.
Okay, so picture this. The left ventricle is like a water balloon. HFrEF heart failure with reduced ejection fraction, that's like a weak balloon. It can't squeeze out enough water, or in this case, blood.
Makes sense. So less blood getting where it needs to go. What about HFpEF? That's heart failure with preserved ejection fraction, right? So the squeezing action is fine, but
Exactly. HFpEF is more about the filling. The balloon, our ventricle, gets stiff, can't fill up properly, so even if it squeezes fine, it's still not delivering enough because it's starting with less.
like a supply chain issue, but for the heart. So weak pump or low supply, same result. The body's starved for blood flow. And that's where these incredible mechanical support devices come in, right? Like having a backup generator for your heart.
Spot on. And this paper covers a whole range, from simple to mind-blowingly complex.
Yeah, starting with something called an IABP. I gotta say, the name sounds a little gentle for something that's keeping someone alive, doesn't it?
It does have a bit of a harmless ring to it, but believe me, it's a lifesaver. IABP stands for intra-aortic balloon pump, and it basically acts as a little helper inside the aorta.
Okay, I'm picturing this tiny balloon in an artery, but how does that actually HELP a failing heart?
It's all about timing. So this balloon inflates and deflates right in sync with the heart's rhythm. When the heart relaxes, the balloon inflates. This boosts blood flow to the coronary arteries, the ones that feed the heart muscle itself. Then, just before the heart contracts, the balloon deflates. This eases the heart's workload.
So it's giving the heart a boost A&D, a break. Clever.
Exactly. It's often used in emergencies, like during a heart attack or after surgery, gives the heart a fighting chance to recover. But what if someone needs more than a temporary boost?
Well, then things get really futuristic. The paper talks about this device called an Impella, which is apparently so small it can fit through an artery.
The miniaturization of this technology is astounding. It's a 20 pump inserted through an artery, usually in leg or arm, and it's carefully guided up to the heart. Once in place, it helps pump blood from the left ventricle out to the rest of the body.
So instead of just assisting the ventricle like the IABP, this Impella is actually sharing the workload of pumping blood.
Precisely. And there are different Impella models, each with different pumping capacity. The paper mentions the Impella 2.5, the CP, and even the 5.0 and 5.5, which needs a surgical procedure to put in because they can support even more blood flow.
Levels of heart assistance, it's amazing. The more severe the heart failure, the more powerful the Impella needed. So cool. But what about those cases where even the most powerful Impella just isn't enough?
That's when we enter the world of LVADs, left ventricular assist devices.
Okay, those sound serious. Tell me more.
Imagine this. A small but incredibly powerful pump implanted directly into the left ventricle. And get this, it essentially takes over the job of the ventricle.
Hold on. So it actually pulls blood from the heart and pumps it out to the body. That's like a mini artificial heart, specifically for that one chamber.
You got it. And they've come a long way. This paper describes how they've evolved from these early pulsatile pumps that tried to actually mimic a heartbeat to the newer continuous flow pumps. Apparently, the HeartMate 3, which uses centrifugal flow A&D magnetic levitation, is the most common these days.
Magnetic levitation. Okay, now that just sounds like something out of Star Trek. So someone could be walking around with one of these HeartMates and you'd never know.
It's pretty remarkable. It really highlights how life-changing this technology can be. Sometimes it's a bridge to transplant, giving people precious time while they wait for a donor heart. And sometimes it's a long-term solution, allowing people to live full lives with the support of this device.
Seriously incredible. But you know what's even more mind-blowing? This paper also talks about total artificial hearts. Replacing the entire heart. Is that even possible?
It does sound like something out of a sci-fi movie, right? But yeah, total artificial hearts are a reality. The Syncardia total artificial heart is the only FDA-approved one here in the U.S., and it's used as a bridge to transplant. So for folks with really advanced heart failure, it could be a lifesaver.
So they're literally living with an artificial heart beating in their chest while they wait for a transplant. That's wild.
It's a huge surgery, of course, and recovery takes time. But the fact that this technology even exists is pretty remarkable.
Really puts things in perspective. Speaking of hearts, so far we've mostly been talking about the left ventricle, which this paper says is kind of the troublemaker of the heart. But what about the right side?
You're right, the right ventricle has its own set of challenges.
Okay, so just to refresh my memory, what exactly does the right ventricle do again?
So the right ventricle's job is to receive that deoxygenated blood from the body and pump it over to the lungs to pick up some fresh oxygen.
Right, right. So if the right ventricle's not working properly, the blood can't get to the lungs to get oxygenated.
Yes,
That's got to be a problem.
Exactly. It can cause fluid buildup in the body, and without that oxygen circulating, things go downhill pretty quickly. And as this paper explains, finding long-term solutions for right ventricular failure has been tricky.
So what can be done? Are there like right ventricle versions of those devices? We talked about the IABP, the LVADs, and all that.
For short-term support, there's the Impella RP. Think of it as a miniature pump, but designed specifically for the right ventricle.
It's like the Impella's little brother.
Exactly.
Okay.
And just like the Impella, it's put in through a vein in the leg and carefully moved up to the heart where it can help pump blood to the lungs. This paper mentions it can pump up to 4 liters of blood per minute.
Wow, that's a lot of blood for such a small device. But what about for the long term?
Long-term support for the right ventricle is definitely more complicated. The right ventricle's shape and location make it tougher to implant a device for the long haul.
So doctors are having to improvise a bit.
In a way, yes. Sometimes they'll actually use an LVAD, those left ventricular assist devices we talked about earlier, but adapted for the right side. But it's not ideal, since that's not their primary purpose. The paper also mentions another option, the tandem heart, which is for short-term right ventricular support and sits outside the body.
So there are options, but it sounds like there's a lot of room for innovation in right ventricular support.
Definitely. It's an area of ongoing research.
Well, it's amazing that even with these limitations, there are options for patients who need them. It speaks to the ingenuity of this field, always striving to bridge that gap and give people hope.
I completely agree. It all comes back to what we were discussing earlier, even with the risks involved. These technologies give people a fighting chance when facing some really tough health issues.
Totally. Okay, so we've talked about devices to assist both the left and right ventricles, but this paper also mentions total artificial hearts, which seems like, I don't know, the ultimate intervention. Assisting a ventricle is one thing, but replacing the entire heart is a whole other level.
It's a huge decision for both patients and their families. This isn't just a quick fix, it's a major surgery, long recovery, and just like any big medical procedure, there are risks.
Right, so let's talk about those risks. What does the paper say about potential complications from a total artificial heart?
Well, kidney failure is a big one, along with blood clots and the ever-present risk of infection.
So even though it's amazing technology and can be truly life-saving, it's not without its downsides. It's about weighing the potential benefits against those risks.
Exactly. That's why the decision to go with the total artificial heart isn't taken lightly. It's usually reserved for those with the most severe heart failure, those who don't have other options.
It sounds like this paper really emphasizes that using any of these devices, IABP, total artificial heart, anything, it's a decision that needs careful consideration. Patients need to fully understand both the potential upsides and the potential downsides.
Absolutely. It's a delicate balance, and it takes a true team effort between the cardiologist, the patient, and their family. One thing this paper does a great job of is highlighting how dedicated these medical teams are, how much they care about giving their patients the absolute best care possible.
It's really inspiring, yeah. But, you know, it's not just about the heart, right? We touched on how these devices can affect other organs, particularly the kidneys, and it seems like with total artificial hearts, kidney failure is a real concern.
It is a concern. There's research that suggests a link between total artificial hearts and changes in kidney function. It seems the syncardia heart, in particular, can cause a sudden decrease in a hormone that helps regulate blood pressure and fluid balance.
So the body's trying to adjust to this new heart, and the kidneys are kind of caught in the crossfire.
That's a good way to put it. And that can lead to kidney issues, even in patients who didn't have them before.
Wow, that's really important to know. So doctors have to keep a close eye on kidney function in anyone with a total artificial heart.
Absolutely. It's all about careful management of medications, fluid intake, all of that. And in some cases, dialysis might even be necessary. It's about seeing the bigger picture.
Which makes sense. We're not just talking about individual organs here. We're talking about whole systems all connected.
Wow.
And when one part's off, it can have ripple effects throughout the body.
You've hit the nail on the head. It's this intricate dance of managing not only the heart, but also the way the entire body responds to these interventions.
And speaking of managing the whole body, this paper also talks about ECMO, which we touched on briefly before. It's like the ultimate backup system for when things go really south, right?
It truly is an incredible piece of technology. As you mentioned before, there are two main types, VA ECMO, which supports both the heart and the lungs, and VV ECMO, which is primarily for when the lungs need help.
And this paper really digs into the complexities of ECMO. It's mind-blowing that we can essentially replace the function of these vital organs with a machine outside the body.
It really does highlight how far we've come. But of course, like everything else we've talked about, it's not without risks and considerations.
Right, we've mentioned the general risks like blood clots, bleeding, infection, but we've also been talking a lot about the impact of these devices on the kidneys. Does ECMO affect the kidneys too?
That's a great question. And it's definitely something this paper spends some time on. It seems ECMO, and VA ECMO in particular, can be especially rough on the kidneys.
Is that because of how it changes the blood flow?
That's a big part of it.
Yeah.
Remember, with VA ECMO, blood is pumped out of the body, oxygenated, and then pumped back in. This puts extra stress on the kidneys as they try to filter everything. On top of that, ECMO triggers this inflammatory response that can cause even more damage to the kidneys.
So it's like a double whammy.
Exactly.
Yeah.
And there's research showing that acute kidney injury happens in a significant number of patients on ECMO. Sometimes it even requires dialysis.
It seems like no matter what device we're talking about, whether it's an IABP or a total artificial heart or ECMO, there's always this balancing act, trying to support one system without putting too much strain on another, and the kidneys just seem to be really vulnerable.
It's a great observation. It really emphasizes how interconnected everything is and just how complex these interventions can be.
It's a lot to take in, for sure. And speaking of taking things in, I think we need to talk more about dialysis and how it all fits into this. So we were talking about ECMO and how it can impact the kidneys, sometimes to the point that dialysis is needed. And I imagine that adds a whole other layer of complexity for these patients, right?
Oh, absolutely. The paper really digs into that. Managing dialysis in these patients is its own beast. It's not as simple as just, hooking someone up to a machine.
Yeah.
Even the type of dialysis used can make a big difference.
Okay, so what are the options here, and how do doctors decide what's best for each patient?
Well, the paper says that for folks with LVADs, hemodialysis is usually the way to go.
That makes sense, right? If they already have the LVAD implanted, adding another device like a catheter for hemodialysis is probably less invasive than some of the alternatives.
Right, but it's not without its downsides. Remember how we talked about the risk of infection with all these devices? Well, hemodialysis, especially when a central venous catheter is used, bumps up that risk. And an LVAD infection, that's a whole other can of worms.
So it's this constant balancing act, isn't it? Trying to provide life-saving treatment while minimizing the risk of serious complications. Are there any alternatives to using a catheter for hemodialysis?
There's one the paper mentions, creating an arteriovenous fistula.
Refresh my memory, what exactly IV is a fistula?
It's basically a surgical connection made between an artery and a vein, usually in the arm. This creates a bigger, stronger blood vessel that can handle those repeated needle insertions needed for hemodialysis.
Ah, right, so it's a more permanent access point. Makes sense, especially for someone who might need dialysis long-term.
Exactly. But there's a catch. We don't have a ton of research on how well fistulas work in patients with LVDs. Remember those continuous flow pumps? Well, they create this non-pulsatile blood flow, and it's unclear how that might affect the fistula, both its development and its function.
So it could be a good option, but more research is needed. Okay, what about peritoneal dialysis? Is that something that could work for these patients?
You're on a roll with the questions.
Yeah.
And yes, the paper does mention peritoneal dialysis as a possibility. But just like with fistulas, there isn't a lot of data on its effectiveness or safety in this specific patient population, those with mechanical circulatory support.
So it seems like the big takeaway here is that managing kidney injury in these patients is complicated. There's no easy answer, no one-size-fits-all approach.
You nailed it. It's all about personalized medicine, looking at each individual patient, what devices they have, and weighing the pros and cons of each dialysis method. It takes a whole team, cardiologists, nephrologists, and of course the patient themselves working together to figure out the best course of action.
It's honestly mind-boggling when you think about all the factors these medical teams have to juggle when caring for these patients.
It really is. But it just goes to show how far we've come in treating advanced heart failure. It wasn't that long ago that these conditions were pretty much a death sentence. But now, with these devices, people have a fighting chance.
Absolutely. It's amazing to see how far medical science has come, and it sounds like the research is constantly evolving. Any final thoughts from the paper about where this field is headed?
Well, the big emphasis is on the importance of ongoing research and innovation. As incredible as these devices are, there's always room for improvement.
Of course, making them smaller, longer lasting, less likely to cause the complications we've been talking about. Who knows, maybe someday we'll be able to regenerate heart tissue so people don't even need these devices at all.
Would that be something? It's exciting to think about the possibilities.
It really is. Well, I've got to say, my mind is officially blown. We've gone from balloons in arteries to full-on artificial hearts, and it's clear that this field is only going to get more amazing in the years to come.
It's been quite a journey, that's for sure.
Before we wrap up, what really stood out to you from all this research? What's your big takeaway?
You know what I keep coming back to is the incredible dedication, the ingenuity, the compassion that drives this field. It's truly inspiring to see so many people working tirelessly to improve the lives of those facing such serious health challenges.
So well said. And that sense of hope, that determination to push the boundaries of what's possible, that's something we can all take inspiration from. Until next time, keep those brains buzzing, folks, and never stop exploring the amazing world around us.